So if you've never had a dental implant or you're not really sure what the process is like, your first step is really a diagnosis, which means an x-ray and a cone beam. It's like a dental CAT scan of that area of the jaw. That gives you a 3D image of exactly what the bone volume looks like, so you have an idea how much bone is there, so how you can size the implant appropriately. Once that's done, some molds are usually taken and those get uploaded into another computer, and you can have a digital guide printed out that basically directs the placement, the depth, the angulation of the implant. So it takes all the guesswork out of the process.